Hi, everyone.
Hold on one second. Sorry, hold on one second. Hey, Carol.
Hey, how are you?
Good. I'm just on the phone. I'll be back in a few minutes.
Hey.
Go ahead. Sorry. Go ahead. Yeah.
Hi, Carol. How are you? Can you hear me?
I can. Susan, can you hear me?
Yes, I can. Oh, good.
Good. So I've never used Zoom before, so I did a run through this afternoon with Anna Bennett, so hopefully all will go well.
Yes. Okay, very good. I don't know if you want us to have our video on as well, or
It's entirely up to you.
Mhm.
You know, some I know are just connecting by audio, so
Okay.
it's entirely up to you.
All right.
We have just 6 people on right now. We're supposed to have over 50, so I think, you know, we'll give it, well, it's technically not 5:30 yet, so we'll give it some time for others to join. And in the meantime, if you want to, you can mute your mic and then unmute it when the call opens up.
Sounds good. Thank you.
It's John Brest. Can you hear me?
I can hear you.
Okay. So I'll mute myself, I guess, now until
Yep, until
time
we
to
get
start.
started. Yep, absolutely. Thank you.
Never mind. Hello,
Hi,
it's Mary Ann.
hi, Mary Ann.
How are you, Carol?
Good, how are you?
I'm good, thank you.
Are you on your
Carol,
cell?
I'm on my cell phone.
Okay,
I got home from work and took my scrubs off and took a shower, threw everything, and so you don't want to see me.
okay. So we have 14 people on at the moment. We're supposed to have over 50. So just going to wait a few more minutes before we get it started. So if you want to mute your mic until then, that would be good.
Sure.
And so we're waiting for Jean and Brittany also. Oh, there's Brittany.
Hi,
How are you?
I'm good. How are you? I was just figuring out how to mute myself.
Um,
I got it now.
you got it. Okay. You're gonna have to give me a lesson when I come out there.
I will for sure.
And we're just waiting for one more. We're waiting for Jean to dial in. We've got about 20 people on right now, and that's about almost half of what registered. So we'll give it a few more minutes. We're just going to give it a couple more minutes and then we'll get started. So thanks for your patience, everyone. Brittany and Susan, I'm trying to unmute you and it's not letting me, so maybe you have it muted on your end and I can't do it. So,
I just unmuted myself, Carol.
okay,
Me too.
okay, great. Okay, well, I think that in the interest of time, we're going to go ahead and get started. So I want to thank everyone for taking the time out to join this call this evening, and also to the folks that are volunteering their time to answer your questions for you. Just a couple of housekeeping items. If I can get my slide to advance, which I'm having trouble. There we go. So this call is meant to be a general Q&A session. Really no set agenda. I have everyone muted except the folks that are volunteering to answer your questions for you. We ask that you use the chat feature to submit a question, and we will field the question to our volunteers. And we know also that in addition to our panel, we have other clinicians that are participating this evening. So of course, we would welcome your commentary as well. You can certainly use the chat feature if you'd like to share or any dialogue, and we will unmute you. And this call is also being recorded, so we will make it available to everyone after the call in case you know of others that would be interested in hearing the information. So before we get started, I want to acknowledge those that have volunteered their time tonight to answer your questions and provide commentary as necessary. First, we have Anna Bennett. Anna began working at the iPro ESRD network of New York in 2010, where she currently serves as emergency manager and quality improvement coordinator. Prior to her work with the network, she served as a volunteer patient advocate. She is a former home hemodialysis patient and received a deceased kidney in November of 2008. We also have Dr. Jonathan Bress with us. Dr. Bress is a nephrologist with Rochester Regional Health. He is board certified in internal medicine and nephrology. He graduated from the Weill Cornell Medical School in 2002 and completed his fellowship at the University of Pennsylvania, where he won the Renal Fellow Teaching Award. We have my good friend Jean Culinary, acute care nurse practitioner, with us tonight. She is a certified nephrology nurse since 1997 and has worked in critical care, renal transplantation for 24 years, in adult and pediatric dialysis and apheresis for the past 7 years at Albany Medical Center. She is a member of ANNA and is on the editorial board of the Nephrology Nursing Journal. We have Susan Chong with us. Susan is the lead for Fresenius Kidney Care, Western New York, which spans upstate New York and Connecticut, as well as parts of northern New Jersey and Pennsylvania. She has been a renal social worker for 10 years, and in her role as the lead social worker, it enables her to provide education and training to all clinical social workers on a macro level to help improve service delivery to dialysis patients. We have Sue Covey with us tonight. She's a renal dietitian for Fresenius Kidney Care, Capital District Dialysis. She is the chairperson of the Hudson Valley Council on Renal Nutrition, and she's also one of the authors of the Northeast Kidney Foundation's Renal Exchange booklet. She has worked with us on a variety of activities, including a number of presentations to our kidney community. We have Marianne Newman with us. She is the facility administrator at Troy Dialysis. She's been a clinical manager for 22 years, and prior to joining Fresenius, Marianne worked at Albany Medical Center for 20 years, concentrating in nephrology and pediatrics. We have Brittany Root with us. She has been working as a kidney transplant social worker since August 2019 at Upstate University Hospital in Syracuse. She tells me that she fell in love with this population while an intern in graduate school from 2016 to 2017. She is thrilled to be back serving this community and helping to foster relationships between transplant programs, dialysis centers, and organizations such as the Northeast Kidney Foundation. So again, thank you all for volunteering your time to be with us this evening. And I know that we have other clinicians on the line as well that will certainly add to the conversation as we go along. Just a reminder, please submit your questions through the chat function and we will field them to the appropriate responder. I do have a few questions that were submitted by email, so I'm going to get the conversation started by asking this one. And Dr. Breath, I'm going to send this to you.
Sure.
We have a woman who's asking what you are seeing in terms of severity of the illness on dialysis patients. Her husband is the patient. He has not contracted the illness as of yet, but she is concerned about the will and concerned because of what is being said in terms of severity for those with chronic conditions.
Well, I think the best thing you can do is really hand hygiene and keeping distance. And I know if you're worried about dialysis patients specifically, is that the question?
Yes, that is the question.
So most dialysis units should have a policy in place by now. And most chairs by regulation outpatient have to be a certain number of feet apart. So you probably already are 6 feet apart from your neighbor, so to speak, on hemodialysis. Most units in my area, I'm in the Rochester area, including the ones at Rochester Regional Health, as we have 2 outpatient units, and we attend Fresenius and DaVita units as well, are masking all patients upon entry. And all patients are being screened by temperature as well as the staff or anybody who's coming in to the treatment floor. So I think those are the best things that can be done. Also, fever is one of the highest percentages in terms of symptoms. So if you have a fever, you need to notify somebody on the treatment floor as soon as possible. You should already be masked coming in regardless. Each unit will have a protocol. I can give you the example at our unit if that's okay.
Sure.
So at Seneca Ridge and Bay Creek, which are 2 of the Rochester Regional Health owned units, if anybody is suspected, they will be dialyzed, but then upon the next dialysis in the evening, they'll be placed on a 3rd shift or in the evening in a separate pod and noted as a person under investigation or a PUI. If they return negative, then they can come back to the treatment floor and still mask. If they're positive, we have yet another pod that will be dedicated for those that test COVID-19 positive. So I think the best thing you can do is hand washing, not going out beyond what you need to except for your dialysis sessions. But it's important not to skip your dialysis sessions. There was a paper, I mean, this is all observational. There was a paper about dialysis patients in China and their death rates and complications from the COVID or during this session, during this time period. And it turned out that there were actually some deaths, probably from high potassium volume overload, as people were avoiding dialysis because of the COVID virus. So it can be just as dangerous, if not as much, to avoid going to dialysis.
Okay, great, thank you. Marianne, is there anything that you want to add?
No, Carol, I think what the doctor was saying is exactly true. At our clinic, at the clinic that I work at, not only are the patients masked the minute they come in, but all my staff were masked all day. The only time we are not masked is in the bathroom or in the kitchen. And it doesn't matter if your office is right on the treatment floor or quite a ways away. We are all masked. Everybody wears full PPE when we are patient facing. So we believe that doing that, we have a very low risk of anybody contracting anything. But again, as the doctor mentioned, hand washing, good hand hygiene, using soap and water or some sort of hand dispenser is what is the most important.
Okay, thank you. We do have a question that was just sent in through the chat feature, which I believe all the panelists can see. It's regarding data on children with kidney disease being affected with COVID-19. And do you recommend also that adult post-transplant patients continue with routine doctor's visits, or should they put those on hold at this time? So Anna, I know the pediatric question came up during the call yesterday. Do you want to address the statistics on that?
Carol, can you just reiterate the question? My computer cut out for a second.
Sure. We have a mom that's asking, have you seen any data on children with kidney disease being affected with the virus?
Oh, I can, and I can speak for New York State. We don't have any reported pediatric cases, and we're watching out for that as well. So we have dialysis facilities that send in their data. If they have patients who they're under investigation, or if they're confirmed as positive, and we haven't had any pediatric cases reported yet. And I've not heard of any on the West Coast either. I attend national calls, so I haven't seen anything.
Great, thank you. And then the question about adult post-transplantations, should they be continuing with routine doctor's visits or should they put those on hold at this time?
I don't know if you want me to answer that. It's John Bress here.
Sure.
Well, we see patients, I mean, I'm not a transplant physician, but we do see transplant other patients, obviously, who are higher risk of advanced kidney disease. Our office has called all patients that are off, not dialysis, meaning office patients over the next 2 weeks with a plan. Now the government is allowing and has waived HIPAA to make it much easier to do telephone visits or telemedicine visits for any of your patients. So if it's a non-urgent visit, I would recommend postponing and talking to your office or your physician if there's a question, so your individual one. If it is more urgent, your physician or practitioner feels it's more urgent, you could ask if a telephone counter is appropriate. So we've done that to protect the population. The people we are having come to the office are those with, generally speaking, lower blood counts who need injections for their anemia or low blood count. But we've really had our office visits limited to a very minimum. And any physician now should be able to bill as long as they're on their office or hospital property doing a telephone call. And that's what I have done for the majority of my visits. Thanks.
Great, thank you. Brittany, I have a question I'm going to send to you. This is from a transplant recipient.
Mhm.
It says, I'm a kidney transplant recipient and get my immunosuppressants through Medicare Part B, and there is a 30-day limit. It is not unusual for the drugstore to run short on availability. How can I get a 90-day supply as is allowed under Part D to avoid missing a prescribed dosage, especially during this current health crisis? Do you have any good suggestions for her?
So I would just encourage her to follow up with her specific clinic. I know patients have been calling us with similar concerns, and our coordinators have been working to try to get scripts available more long-term for them because we are trying to limit their activity in public due to immunosuppression. So we've been working with patients trying to write those types of scripts, working with pharmacies. So I think it's kind of I don't want to say an as needed basis, but I feel like it's a very uncertain time and people are willing to work with this type of thing. But I can definitely understand the concern and the frustration because I feel like that type of thing typically isn't something that can be bent, but we've been trying to work with people as best as we can.
Thank you. So I have a comment from Sue Hartfield, who is a PA. She works in transplant and she says, we are postponing non-urgent visits. We are working in 2-week blocks, rescheduling patients. So thank you for that, Sue. Okay, I have another question. This for Sue. I had a patient ask what happens if there is a complete shutdown. What kind of shelf-stable foods do you recommend? Sue? Susan Covey. Let me, we have a couple of Sues on. So Sue Covey, can you answer that question?
Is she unmuted, Carol?
On my end, she's unmuted.
Okay.
So I'll go back to that in a second. I have someone that's asking if anyone has noticed an uptick in missed treatments. So I guess I would send that to Mary Ann, Dr. Bress, Susan, any of the folks that are working with dialysis patients?
Hi, it's Mary Ann. We have not. Every patient has been very, very compliant with their treatments. They understand that the last thing they want to do is end up in the hospital because there's germs there, and they want to stay well. So at my clinics and the clinics that I speak with, we have not had any problem with treatment non-adherence.
Great, thank you.
I agree with that, John Bress here. I agree with that. We haven't had any major issues, and as you said, patients want to stay away from the hospital. And just to reiterate from the data coming out of China where this all started, a certain amount of death from the dialysis patients was probably from shortening treatments or not going to treatment because of fear. So I think all of the units in my area, ours, Fresenius and DaVita, have all planned well and made the patient feel safe. And that's the key.
Great, thank you. I have a question from someone that says he's actively trying to get on the transplant list and is worried that this will ruin his chances. Are people still being added to the list?
This is Brittany Rue. I can speak to that just a little bit. So as of right now, this has kind of been discussed. Our clinic is trying to eliminate as many people as we can on our clinic schedule, just because we are in the hospital, and as you know, everyone's been saying, everyone's trying to avoid the hospital. So all pre-patients visits have been canceled in our clinic. However, we are still encouraging them to get whatever testing they can to complete whatever they need to get active status on the list. So whether that's, routine colonoscopies, things like that, anything that's open and they can go to and they feel safe going to, we're encouraging them to keep going.
Great, thank you.
And Carol, this is Anna. I just want to add to that. This is a temporary situation, and because of the way the waiting list is working for transplant now, if you're on dialysis, you're accruing time on the list as far as priority goes. So even though it's upsetting if you're not able to get all of your clinical appointments done now while we're in the middle of this COVID crisis, you will be able to get back, and you're not losing any time on the waiting list if that's what you're really worrying about. So you will be able to get back into that routine, and you're not going to lose any time on the list once you are listed.
Great, thank you, Anna. And I have a comment from Sue Hartfield regarding the 30-day supply of medications. To get more than a 30-day supply of medication, paying cash is an option if it is an option for the patient, if Medicare Part B will only pay for a 30-day supply. And she's saying their evaluation process is cut back as well. Sue Covey, I'm wondering if you can respond to the question about what kind of shelf-stable foods should patients have on hand right now? Okay, Sue is having trouble with audio. On my end, Sue, you are not muted on my end. I don't know if you're muted from your computer or phone or not. But she did type an answer, and she wrote, they can use low sodium canned tuna, salmon, can rinse them to remove more salt, canned fruits such as peaches, pears, applesauce, juices such as cranberry juice, low sodium canned chickpeas. Goya brand chickpeas are not as high in potassium as other beans, and a half of cup can be used, but check with your dietitian if you can. And I also know that the National Kidney Foundation just sent a blast email with a link to shelf-stable foods, so we are going to share that as well. This question is for the social workers that I have on the phone. Lots of folks are dealing with isolation and depression right now, and people are asking about coping mechanisms and what are some of the things that we can do to not feel disconnected from others when we're being told that we have to be distant right now and sort of holed up inside our homes.
Carol, I can talk on that. This is something that we've really not experienced in the past. It's just kind of frightening. It creates anxiety. It creates depression, going through these uncertain times and not knowing what tomorrow is going to bring. If you're watching the news, I know people get very anxious, our patients included, and we're all fearful of catching this virus. And, we're being told to stay away from each other and really not go into public places. And we should not be in any place where there's more than, 10 people together in a room. So given that scenario, even for not just our patients, but for everyone, I think, this is a very difficult time emotionally. I know people's emotion have been more labile, meaning that people are upset, and people are scared. They're worried about just apart from being sick and on dialysis, what they may be experiencing shortage with food. They may be experiencing problems with their income. So this is, a critical time that the social workers can really reach out to our patients and make sure that they are okay. We are asking the social workers during this crisis in our clinics to be present because their presence is really needed to, first of all, because we're so short-staffed all over, the social workers and dietitians are helping with the screening process for our patients every day as they're coming in, as well as anybody that is walking in through that clinic. We want to make sure that infection control is in place and that we're taking every possible precaution. But at the same time, we are checking in with all our patients to make sure that they know that we are there for them. And if they're not feeling well, if they're feeling depressed or anxious, then we're here to help. We have online support groups. We have platforms from Fresenius Kidney Care that is kind of created for patient support during this time. And I think it's believe it or not, I think it's a good time to be on that platform because of so much information that we're getting, as well as, the emotions that we're experiencing. So that is a nice platform for people to be on. I've had requests from social workers throughout who have, this is kind of new for us, the support group that we've created under Fresenius Kidney Care that's available to all patients as well as to their family members. So it's kind of new. It's only been around for maybe a couple of months, but I've had more requests now from social workers throughout my region asking for online support so that patients can reach out and talk and do FaceTime even. You're missing your family because you can't see them very often. And so, what we say, talk to them, see if it's possible for you to do FaceTime. We're using Microsoft Team Telehealth as well in our clinics. And that may be, a mode for our patients also to get in touch with their friends and loved ones, to check in on them as well, and to, start feeling better.
Great, thank you so much. The Northeast Kidney Foundation, you'll see in our newsletter that is going to come out next week, we're taking a poll from our constituents to see what other online resources we can offer during this time. So we have some folks that have volunteered to do online meditations with patients, to stream like chair yoga classes, those kinds of things. And we are also asking our artist to see if she would lead like a paint and sip class over the internet as well. So, we know it's important to try and do activities to keep folks connected at this time. So any suggestions anyone has for us would be great. I'm going to ask Jean Colinieri this one, and of course, Dr. Bress can also comment if you'd like. But I have a question from a woman, Jean. She says her son who lives with her works in a hospital. Are there any special precautions that she should take? She had a transplant 33 years ago, and she takes 5 milligrams of prednisone daily plus 125 milligrams of Imuran daily, but she's concerned because of the fact that he does work in a hospital, that she may be, she may be risking exposure, and she's wondering if we have any recommendations. Jean? Jean, can you hear that? Okay, Dr. Bress, do you want to?
Yeah, I can answer. I was waiting for the other person, Jean, if she was going to pop in. I would say, I mean, there's no clear answer on this, and I'm sorry to have to say that, but most of us, I mean, are keeping the same protocols. What I would recommend doing is we've gotten scrubs and changed out of our street clothes in a locker room or wherever when we get to the hospital, meaning the person is a healthcare worker, the son in this case, and then having the scrubs or leaving the clothes in their locker, and then coming back in their street clothes. But beyond hand washing, I don't think there's much else different I would do. It may be a reasonable idea for her. I mean, I would defer to the transplant physicians to self-monitor with a temperature once a day. And obviously, if she feels ill, that's something else. That would obviously be a cause for concern. But I think that's all I would do differently if somebody's on Imuran and prednisone. But I think leaving the clothes at the hospital, if it's a hospital worker, is reasonable, coming home in your street clothes. And again, hand hygiene is probably the most important thing, but it may not be unreasonable to self-monitor with a thermometer if she has one at home, and she ought to if she's a transplant patient.
Great, thank you. Jean sent a note also that the audio doesn't seem to be working on her end, so I apologize for that. I do show, Jean, that you are unmuted on our end, so clearly I need more instruction on Zoom conferencing, so my apologies. We also have a question from a living kidney donor. Is it okay for her to be working? Or is she considered high risk because she gave a kidney? She works for the government and in a position where she has a lot of public interaction each day. She's taking, the 6 feet back precaution, washing her hands frequently, using hand sanitizer, all of those. But she's wondering, because she gave a kidney, is she considered a person that would be higher risk?
Well, I don't think she would be, because if she gave a kidney, and I'm assuming she's healthy otherwise, let's assume that if she gave a kidney is reasonably healthy, I would not put her at any higher risk than anybody else working for the government. Of course, working in the government's a high-risk group. My father worked for government, but that's just a small joke. You got to watch out for those government folks. But in all kidding aside, if you have a kidney removed, there should not be any higher risk if you have a normal kidney function, which she must have had to be able to donate. So I wouldn't say she's any different than anybody else in the population, assuming she's otherwise healthy.
Okay, great, thank you. And I'm actually going to throw a question out there today that I saw on Facebook. It's actually from one of my coworkers. She had an exposure. She called her doctor. She got a call back from her doctor, who referred her to the local health department. She called the local health department. The Department of Health said she should be tested, sent a recommendation to her doctor. Her doctor sent her to where she thought was a COVID testing site, but it was a fever clinic where they were not testing for the virus. So we're a little confused about the testing process. So I don't know if Dr. Bress, you can speak to this, Jean or Marianne, anyone that can speak to really what the procedure is if you've had an exposure and what you should do.
I can, if that's okay. So we also, as healthcare providers, have had exposures as well to known cases. So I understand everybody wants to get tested. And as Dr. Mendoza said, who's our Monroe County Health Commissioner, but there just simply aren't enough tests or resources. And the labs at least in our area at Rochester General Hospital, where I am in U of R, are all quite backed up. So if you're exposed, and you're feeling well, I am not sure at this point. It's not clear that being tested helps, because there isn't a difference in treatment right now. Because we should all be practicing isolation. And if I were that person, I would assume that they may be a carrier and to stay away from others as much as possible. But if they're not febrile, not ill, and even if they were, it's not clear what difference you would make at this point. Obviously, if you're so sick, you would end up in the hospital. But there's so many contacts at this point, we would kill the system if asymptomatic contacts got tested. Though, yes, I realize in the ideal world, we should be able to be tested. But if that person's feeling well, it's hard to argue, and they're healthy, generally healthy. That's the other caveat. Geez, it's hard to argue to make them go out and expose themselves even more in a line of people who may have it.
Great, thank you. And Jean Collinari wrote a comment also, the test kits are being rationed here to use for hospitalized patients and for exposed healthcare personnel. She agrees with Dr. Bress, there are just not enough test kits at this time. So thank you both for commenting on that.
And I also would just quickly say, I mean, I also count, and people want to know if they're positive. I understand it's important. But as I counsel, what else would you do about it? I mean, obviously, if you're really ill and can't breathe, you would be in a hospital and work from there, and then that's a different issue. But even if you're at home, I personally know people who have the COVID virus, and they're at home. Yes, they didn't feel well and had fevers of 102 and not well. I mean, they're younger, on the 30s and 40s set. But at the same point, there's not much different they would do except take Tylenol and things like that. And even if they didn't feel well, for even though it was the influenza virus, not much different at this point.
Okay, thank you. And I had a question emailed in. What is the opinion on going outside to pick up groceries and medications at places that are offering drive-through service? This came in from a kidney transplant recipient, and obviously there is concern amongst the transplant community about not catching this virus. So Dr. Bress, Marianne, Jean, any of our clinicians can respond to that question. I think we've kind of already touched on it, but it was just emailed in. So are there any thoughts about that? Just follow the precautions that everyone else is following, social distance, et cetera, et cetera.
I would say just have, if somebody's a transplant, if they have a family member or contact who can pick things up for them or do drive-through, that would be the best option for those that have chronic illnesses or are immunosuppressed because they have a transplant. That would probably be the best option at this point. If obviously if they're unable, they should go and get the med. If they have nobody to help them, then they should try and do drive-through. And I know a lot of the CVS's, at least in our area, are allowing, that have drive-through, are allowing drive-through pickup. And that's the best way, I would think. But if you have somebody who is a family member or friend, that would probably be the best way. But again, if you're unable to get food or your medication, I would go out and do it as best I can and try to do curbside pickup.
Okay. And Jean and Dr. Bress are on the same wavelength today because she writes that it's best to get others to run the errands, that if possible, that would be the best. So thank you both.
Good to know I'm not getting fired yet.
Carol, it's Marianne.
Hi.
Sorry. One of the things that I wanted to add to that, though, is that, it's okay to go outside. We need to go outside and sit on the porch or take a little walk, or it's good for your mental health. It's just good to get some fresh air. We don't have to, unless we are quarantined for some reason, we don't have to shut the windows, shut the door, and never see the sunlight for the next 2 weeks or a month. So I absolutely agree that it's important for us to be safe and have others do our errands for us if we can, for the transplant patients or for those patients that are otherwise immunocompromised. But it's good to go sit on the porch and get a little air.
Yeah, absolutely.
I totally agree. My dog has never had somebody walks outside. He's loving this.
Mine neither. I mean,
Can't wait. Tomorrow it's supposed to be 70 degrees here in Albany, and I just can't wait to open my windows.
Yeah, the same. We are all working from home, and Coco, if you are friends with me on Facebook, you've seen all kinds of pictures of Coco, but she's had lots and lots of walks. So yes, it's definitely important to get outside. We have a question. What is a fever for someone on dialysis? This person is routinely 97.5 degrees and doesn't know what they should be looking for.
Well, I can tell you, this is Marianne. I can tell you in my clinic, what our company has set out for us is anyone with a patient of a temperature of 100.4 or more would be something that would make us, prick up our ears. I did hear a rumor that that may be decreased to 99.6 or 99.8, but it hasn't happened yet. But certainly we know that dialysis patients and chronic kidney disease patients have a little bit lower temperatures in the 97-ish to 98 range. But if a patient comes in with a temperature of 99, that's going to sort of make us take a look at what else is going on. But it's probably, if you have no other symptoms, it's probably not going to make you have to go get tested at that moment. But I will also defer to Dr. Bress at this moment.
I'm going to defer to you. No, yeah, I agree. I'm just teasing. 100.4 seems reasonable to me. I mean, the symptoms, 99% of these folks have fever. And also it's lower respiratory and cough. So you're getting exactly as you had just said. It's not just the isolated fever. But I would say, but most of the people I have known personally who have this or cases are usually, we see people who are well over 102, 103. So it's not subtle. So I would say 100.4 is a reasonable guideline, as you said.
Great, thank you. We have a question. What would the virus do to a transplanted kidney if contracted? So Dr. Bress and Jean, I'm going to throw this question to you.
Well, I can answer from the literature I have read. So it's not clear to me if there's any different pathology that you would get in a transplanted kidney versus somebody who has, quote, native or normal kidneys. I think it depends on your function, but yes, maybe a higher risk of getting viruses because you're on immunosuppression. But any of us, whether we have a transplanted kidney or chronic kidney disease or normal kidneys, can still get the same kidney failure mechanisms. If you do go into kidney failure, acute kidney failure from the COVID virus, your chance of mortality is quite high. But most people do not. That's only a very small percentage. But it's not clear to me that there would be a different pathology in transplanted kidneys than there would in native kidneys, but I just don't know yet.
Okay, thank you. Jean, I don't know if you want to add any commentary to that. I know your audio is not working, so if you have something to share, go ahead and type it and I will share it with the group. I do have a question that I know several can talk to this, so I'm just going to ask it and probably ask Anna to start the conversation, then I know others can join in. But we have a question about how prepared are the dialysis units for this? What measures are being taken to ensure patient safety?
Well, Carol, I would say that no one's ever prepared for something like this fully, but our dialysis facilities and the staff have really been rising to the occasion. And I've seen a lot of extraordinary efforts happening to make sure that their staff are safe, their patients are safe, and that they're keeping people well informed. It really is something to have your world change overnight, both as a patient and as a staff member. But we're finding that resilience going, day by day, and understanding that there are new guidances coming in for masking people, for screening people before they come into the unit. There's a lot of stress and strain for dialysis facility staff, and Marianne and others can speak to this, that, they have a family that they're worried about too, but they're coming in and they're working and they're working with their patients, and they're doing the best that they can. And we are seeing nationwide shortages of things, but it's being addressed on a national level for protective things, for masks and other things that are happening. So you'll hear of shortages, but there are also policies where you'll be able to continue to wear masks, and you can use that 6-foot distance that Dr. Bress was talking about. So facilities are rising to the occasion, and you can never be prepared enough. And that's pretty much how I'll kick off that conversation.
Great, thank you. Mary Ann, do you want to add?
Sure, I'd like to. You know, I can tell you the company that I work for is Fresenius Kidney Care, and we have conference calls every single day. If it's not national, it's an area-wide, and we discuss new policies that have been put out. And I have to tell you, as Carol mentioned when we started, I've been doing this a long time, and I am amazed and very grateful that I work for a company of this size, that they are putting out policies and they are putting out procedures daily on the best way to protect our patients, to take care of every single patient and provide the best care every single day, as well as providing safety for the staff. So we are wearing, we look, you know, like hazmat suits almost, but not really. We're asking patients to put masks on the minute they walk through the door. There's no visitors, there's no deliveries in the front door. We are wiping things down with bleach all day. My secretary walks around with a can of Lysol. I mean, we are, the first priority is to take care of our patients and to make sure that despite all of this craziness that's going on in the world, they can continue to get the best care that we can provide. And then to also make sure that our staff is safe so that they can go home to their families as well.
That's great, thank you. I don't know, Jean's audio is still not working, so I don't know. Okay, so she has said transplant recipients are unfortunately at a higher risk for complications after contracting a virus. However, they will be closely monitored because they are a risk group. The virus and complications may or may not affect the kidney. If the patient gets very ill, whoops, lost it. If the patient gets very ill, there may be some kidney complications. So that relates to the question that was asked a few minutes ago. And I have a couple other questions coming in. Sorry, should home dialysis patients still need to go to monthly clinic appointments, also lab appointments, if I am not experiencing any issues?
I would
It's
call
Mary
your
Ann.
home dialysis clinic and see what their policy is. At Rochester Regional, we're doing phone visits.
Thank you. Mary Ann, how is your clinic handling that?
At the moment, we are developing our telehealth policies. So we're trying to make it so that we can do as much as possible via phone and computer. If a patient needs to come in for any reason, then we'll do whatever we need to do to offer them the best care.
Great, thank you. Sorry, I'm trying to scroll through the questions as quickly as I can. Jean is also saying that her hospital, Albany Medical Center, is well prepared with adequate supplies and meticulous disinfection. We have adequate beds, staff, and dialysis machines. So thank you for that. I have a question. I have an immunosuppressant infusion tomorrow. Should I take any other precautions other than what has been said? 30 minutes in the hospital has raised some flags. FYI, I always carry mask and gloves. I also take my temp daily. Dr. Bress, do you want to answer that one?
I think that's completely reasonable at this point. As long as the person's feeling well, I think that's completely reasonable. I wouldn't do anything different.
Okay, great, thank you. I have a question. My employer has closed. This would go out to the social workers. My employer has closed. I'm concerned about my medical RX insurance. Is there any advice on taking a leave of absence, SSDI, unemployment?
This is Brittany. I know we've gotten a uptick in FMLA paperwork, short-term disability type stuff. We've been writing people out of work. So I think, it is possible to have that filled out if that's an option. So I know we've been filling those out for patients, just explaining the situation.
Great, thank you. And I'm scrolling through to see if we have more questions that were submitted, and I don't see any questions that were submitted that we haven't answered. If I missed something, you have a raise your hand option and we can certainly address that. But we have gone through all of the questions that were submitted. So at this time, I will just ask if our panelists want to add any commentary. I do know that we are planning to do these calls, every couple of weeks while this craziness unfolds. So we will be having another one probably in about a week and a half to 2 weeks, and reaching out to our clinicians to see if they can participate. We won't ask everyone to keep repeating these sessions with us. We know how busy you are right now, but of course, if you want to participate in the next one, we are open to that as well. So other than that, is there anything that any of our panelists want to share before we end the call? Because I don't see any other questions that have come in.
Wash your hands, keep well, and if they forward you any questions, I'm happy to answer by email or participate in another seminar.
Great, thank you. Anna, anything that you want to add from the network perspective?
Oh, Carol, yes. I mean, I'm so happy that you put these together, and we are really looking forward to working with you on any of these future things for everyone at the network. So thank you for that. And if anyone has any questions for us, feel free to reach out to Carol. We'll be on these calls whenever you have them, and she can also forward questions to us at the network, and we're always there to get back to you. So thank you very much, and thank you for facilitating this.
Oh, thank you. Marianne, do you have anything you want to add?
The only thing that I would echo is the doctor's plea for everybody to wash your hands. That is the most important thing. And please remember to sing happy birthday twice while you're doing it. And I just, again, from a dialysis clinic perspective, want to assure all of the dialysis patients and family members that all of the dialysis clinics are doing everything that they can do to keep everybody safe.
Thank you. Sue just sent a note reminding again about the list of shelf-stable foods that came out from the National Kidney Foundation today, and we are going to distribute that through our email network. So of course, we'll add everyone to our email that has participated in this webinar tonight, so you will get that information. Brittany, is there anything that you want to add?
I think I would just encourage everyone, if they're having questions or they're feeling down or they're feeling stressed out about everything that's going on. We understand this is an incredibly confusing, uncharted, crazy time. So just encouraging people to reach out for support, calling your transplant clinic, asking the questions that you have, letting us help you through this, because, we're trying to navigate it the best we can, and knowing what's troubling you or what questions you have helps us sort of serve the entire community. So I would just encourage people to do that. That's why we're here.
Great, thank you. I actually do have a couple more questions that popped in. So relating back to a question that we asked a couple of minutes ago. To clarify, if I'm on SSDI, does my employer's medical coverage continue? So Susan or Brittany, if you can answer that question. Susan Chong or Brittany.
Hi, this is Susan. I'm not really sure about that, and I don't want to give you the wrong answer right now. However, I can find out. We can find out and get you the information that you need. I know that people are worried about many different things in addition to, being ill, like insurances, their income, their work, as well as their emotional health. And, what I wanted to say is I wanted to reassure our patients and our family that we are, doing the very best and that you are in very good hands. Every day, we are looking at all the information as they're coming down. And although it looks a little scary sometimes, we just want you to know we're trying to be as innovative and we're trying to keep everybody as healthy as we can. You heard about the telehealth program that will now be we'll be using with our patients, whether you are in-center patients or home therapy patients. And this is, of course, to minimize the spread and unnecessary contacts. So that is going to be kind of what is in the works. A short-term solution, I should say, but nevertheless, something that's, I think, very crucial right now. And also in each of our areas for our company, Fresenius, we are locating at this time what we call isolation clinics. We're getting ready so that if needed, and we will need that clinic that is isolated and is going to be used for the purpose of treating patients who are symptomatic or who may be COVID positive. So we are currently working very hard on these things, and we just wanted to make sure that our patients are feeling safe and feeling assured.
Great, thank you for that.
I'd also like to say I remembered when I was speaking that it was SSDI and not employee specific anyway. So that was my fault for answering that poorly. But I want to reiterate as well that I'm not exactly sure how that would work. And I'm also not sure if it would be employee specific information. But as Susan said, we do have transplant specific financial coordinators in our clinic. So if I could, relay that question to them, I could probably find a little bit of a better answer.
Yeah, absolutely. Thank you both. And Jean is also, echoing everyone else, stay calm, get fresh air, we're on your team. And Kidney Foundation as a patient support and advocacy organization, we try to provide as many resources as we can, and we keep good, close relationships with our renal professionals. And so if we don't have an answer for you, we know who to reach out to get an answer. And again, I want to thank all of our panelists for taking the time to participate tonight. Not only are you being inundated at your practice areas, but you are also volunteering your time tonight. And I want you to know how much we appreciate that. And having said that, I don't see any other questions that have come in. So we'll get to end the webinar a little bit early, and it was recorded, so we will certainly share the recording. And if we get additional questions, we will field them out to you. But thank you all again to those that connected from our patient community, and thank you to our clinicians and renal professionals that participated this evening as well.
Thanks, Carol, for putting this together. It was great. Appreciate it.
Thank you so much. And
Bye.
next time I'll be a little more technically savvy. But
I think it went great for the first time. Thanks so much.
all right, thank you. Have a great night.